Hello, welcome to all of you tuning in to this session this morning. We've been all of you have been tracking us as the Alagappan 2020 campaign has been going on towards saving lives. We're so glad that over 2,500 plus people are participating to evangelize this cause of saving lives, and not just here in Chennai, but across the globe. Friends joining in from many different places to we can't really overemphasize the need for preparedness, and the pandemic has really woken us all up in a mass scale. Today, also being the World First Aid Day, the whole context is extremely relevant to this campaign. And how better can we spend our time today than to actually talk to somebody who's actually now, as we speak, is in the front line of fighting the COVID, but otherwise as well, somebody who specializes in emergency, medicine, emergency response, and all of that. And I have with me the pleasure of the head of emergency department from the Apollo Group of Hospitals, Dr. Dhavapalani Alagappan, joining in. Dr. Dhavapalani, such a pleasure to have you with us today as part of this panel.
Thank you, Rajesh. I think it's my pleasure too, in whatever little way I could contribute to spreading awareness and knowledge about first aid. It's my pleasure indeed.
Thank you so much, Dr. Dhavapalani. In fact, I'm sure you are back to back with many things going on. To have spared a little time and got on with us online, it's superbly wonderful. I also have, we'll be shortly be joined by also Mr. Selvakumar, the COO of the EMRI, Emergency Management Research Institute 108, as he joins into this conversation. We'll start off with you, Dr. Dhavapalani. I mean, you know what Alert is into, trying to spread this awareness and build capacity from amongst general public when it comes to handling emergencies. Now, as a doctor, at the other end of the chain of survival, right, or the core end of the chain of survival, where people reach out to you for complete treatment and recovery. If you can talk to us about how much of a difference it actually makes when a victim of an emergency reaches the emergency department, but and has had the opportunity or has had kind of help received from a first responder or some kind of basic first aid that they have received. How has it changed the outcome in terms of recovery for a victim of an emergency?
We've had, I can quote several stories where the intervention that is being provided or offered by the bystanders, not necessarily healthcare providers, at home or wherever the unfortunate person has suffered their illness, and they've had an enormous impact. We've heard stories about moms bringing their children. They had to dig their slapping on their backs. It may not be a proper Heimlich's or a proper back slap, but whatever they do to get rid of the obstruction. We've had hypoglycemia, low sugars being treated by relatives in a sensible way rather than throwing something into the throat. Yeah, so identifying problems. The key thing is to identify what the main issue is and to identify if it is a life-threatening acute problem. And if that, once they've done that, they need to know about what can or what should and shouldn't be done. So that knowledge, awareness, thanks to Alert and lots of other initiatives there, it's improving significantly over the last decade. A gentleman who was brought in, who had a fall. He was just a bit concussed, but this guy wasn't able to keep his consciousness up much from the head injury, but it was a transient thing. But he was brought in blue essentially because his tongue and his secretions were blocking his airway. So it was a very tricky thing. One thing is to think about his spines being protected in the neck. At the same time, the guy having so much of secretions. They there were 2-3 colleagues of his who gently held him to the side, had the secretions down, but they made their attempt to keep his spine in line, and they brought him to the ED. That guy turned out not to have a serious head injury at all, but he was nearly dead from anoxia, from the lack of oxygen.
Okay.
Yeah, so if you think about it, those guys did uh, a wonderful job of keeping him alive. So the head injury, which was thought to be life-threatening, wasn't. So, but he had a very much survivable head injury. Whether he had a fit, and which is why he was less responsive, we don't know. But he came in blue, and he was very sick. And these guys intervened sensibly, and they knew that they should take care of the spine as well, protect the spine at the same time, get rid of the secretion. Well, it is a challenge, and I was so pleased. This was in Chennai, in the department I work in. It's not as if it is from some other place I'm talking about. So I can give you very many examples of how people's intervention in the community make a huge difference to uh, serious emergencies, the outcome of the serious emergencies. Uh, Hypoglycemia, low sugars. So identifying it early when the person is disoriented, sweaty, anxious, agitated, diabetics, and we quite often hear this relatives giving them something sugary when they are at a stage where they can swallow. So when they don't miss the boat, and we hear about that so often. So yeah, it's an endless list.
Yeah, so thank you so much for sharing specifically a real life incident. I think it'll go a long way in instilling in our viewers and also people who actually get trained in first aid and emergency response that it actually influences outcome, and doing it the right way matters the most. So thank you for bringing that aspect out, Dr. Dhavapalani. I'm so glad we also have with us Mr. Selvakumar. Mr. Selvakumar, welcome. It's so good to see you today. Welcome, sir. And of course, introduction to Mr. Selvakumar. He is again the very busy, honestly working on behalf of all of us. Managing the 108 traffic that is coming in. All of us know day in and day out there's work going on. So first of all, congratulations and for the new fleet that you have added. To a new set of vehicles that you have added to your fleet. And to both of you, I'll have to take this opportunity to both of you to say that, as an NGO and as representatives of the public, extremely thankful for this yeoman work you have done during these COVID times. It cannot be underestimated, and this phenomenal work, both from the 108 perspective and of course the emergency departments at the Apollo group of hospitals. So welcome, Mr. Selvakumar, once again to take a little time out for us and choose to be here and talk to our people. So thank you so very much. I'm going to start off, Mr. Selvakumar, with one piece of question, and specifically, you are the 108. Is the connecting piece between the general public and the other side. You got all the hospitals, right? And it's the most important connecting piece in the entire cycle. So it will be wonderful for our viewers today if you can add some light on in the side general public. It needs it's unstructured and it is like chaotic. You might have people on the scene with coming with its own set of challenges, and on the other side you have the hospitals where you will have to deliver and ensure that the victim is taken to treatment on time. In the rend spectrum liyo, in Namma Tamil Nadu பொறுத்த வரைக்கும், there is a lot of course, I think Tamil Nadu வந்துட்டு first of all is ahead in as far as many states are concerned when it comes to this entire system. But Anna, இதுல ரெண்டு சைடுல இருக்கிற challenges, if you can talk us through some of the challenges that you face, and also then I will get to some aspects of how as general public we can help.
Okay. Thanks, sir, for your comments on 108. See, first of all, I will tell you how the 108 works. 108 as a GVK EMRI, we often state the basic three principles. That is sense, reach, and care. The sense means the wherever the incident, whether the accident or maybe the house, whatever the emergency may be, that should be sensed by us. So once it is sensed, we will send the nearest ambulance to the scene.
Right.
The first is what we do is, so when we call the caller, when caller calling to the 108, sir, in the emergency, is there an accident, sir? So where will you, something, whatever it says, so our emergency response officer will ask what is the emergency, and the same need to be conveyed to our emergency medical technician who is in the ambulance.
Right.
So we used to call it a follow-up call. அதாவது இந்த காலர் இந்த எமர்ஜென்சி மெடிக்கல் ஆம்புலன்ஸ் ரீச் பண்ற வரைக்கும் என்ன பண்ணணும், அவங்களுக்கு என்ன டைப் ஆஃப் எமர்ஜென்சி, அண்டர்ஸ்டாண்ட் என்ன டைப் ஆஃப் எமர்ஜென்சி, சார் இதை பண்ணிட்டு இருக்கேன் சார், நான் வந்துட்டு இருக்கேன், ஒரு 5 மினிட்ஸ் வந்துட்டு இருக்கேன். இட் இஸ் ஒன்லி டு கிவ் த மோரல் பூஸ்டிங் ஆஃப் த காலர் ஆஸ் வெல் அஸ் அந்த பேஷண்ட்டை தெளிவாக வச்சுக்கிறதுக்கு. இது அவங்க அந்த மாதிரி எமர்ஜென்சி ரெஸ்பான்ஸ் இந்த இஎம்டி அங்கே போனதுக்கு அப்புறம் நார்மலி வாட் வி ஹேவ் த ஃபேசிங் சேலஞ்ச் ஆஸ் ரைட்லி ஆஸ்க் த கொஸ்டின்ஸ் இன் கேஸ் ஆஃப் ரோட் டிராஃபிக் ஆக்சிடென்ட். when ஆம்புலன்ஸ் போன உடனே பப்ளிக் என்ன பண்ணாங்க, அப்படியே தூக்கிட்டு they don't allow our emergency technician to do first the basic triaging system. For example, in case நீங்க பண்ணீங்கன்னா ஒரு எம்சி மாஸ் கேஷுவாலிட்டியா இருந்ததுன்னா எங்களோட எமர்ஜென்சி மெடிக்கல் டெக்னீஷியன் ஃபர்ஸ்ட் ட்ரையாஜ் பண்ணுவாங்க. ட்ரையாஜிங்ல யார் ரெட் பேஷண்ட் யாரு, தென் ஒரு கம்ஸ் எல்லோ, தென் கம்ஸ் ஒரு கிரீன், அந்த மாதிரி பண்ணும்போது ரெட் ஐடென்டிஃபை அது பண்ண முடியாத அளவுக்கு பப்ளிக் வந்து என்ன பண்ணுவாங்க, அவங்க டக்குனு எடுத்துட்டு ஆம்புலன்ஸ்ல லோட் பண்ணிடுவாங்க. ஃபர்தர் இன்ஜுரிஸ் கூட ஆகுது. இந்த மாதிரி இருக்கும்போது நாங்க ஒரு ஸ்டடி பண்ணது என்ன பண்ணலாம், ஹவு டு ஹேண்டில் திஸ் அப்படின்னு சொல்லிட்டு then we started wherever the emergency எங்க அதிகமான ஆக்சிடென்ட் ஆகுதோ, ஸோ பப்ளிக் ஒரு ஃபர்ஸ்ட் ரெஸ்பாண்டர்ன்றது இஸ் இமீடியட் ரிட்டில் ஆம்புலன்ஸ் கம்ஸ், பேஷண்ட்டுக்கு என்ன பண்ணணும் அதை விட என்ன பண்ணக்கூடாதுன்றதை உங்களுக்கு டீச் பண்ணணும். அதனால நாங்க என்ன பண்ணோம், எங்கெல்லாம் ஆக்சிடென்ட் ஸ்பாட்ஸ் இருக்குதோ வி ஸ்டார்டட் ஒரு 4 டிஸ்ட்ரிக்ட், சென்னை, திருவள்ளூர், காஞ்சிபுரம், திருவண்ணாமலை ஸ்டார்டட். எங்கெல்லாம் ஆக்சிடென்ட் ஸ்பாட் அதிகமா இருக்கு, வேற நம்பர் ஆஃப் இன்ஜுரிஸ் ஹெவியா இருக்கு, டெத் அதிகமா இருக்கு, அந்த ஸ்பாட்டை செலக்ட் பண்ணி we identified the first responders. அங்க நியரஸ்ட் ஷாப் ஓனரா இருக்கலாம், மேபி காலேஜா இருக்கலாம், ஸ்கூலா இருக்கலாம், இவங்கெல்லாம் ஐடென்டிஃபை பண்ணிட்டு ஒரு ஆக்சிடென்ட் ஆனா நீ என்ன பண்ணணும், ஆம்புலன்ஸ் வர வரைக்கும் நீ என்ன பண்ணக்கூடாது அப்படின்ற ரொம்ப தெளிவா பண்ணிட்டு அதை ஃபாலோ அப் பண்றோம். இந்த காலெல்லாம் ரொம்ப தேர் வெரி ஹாப்பி. நாட் ஒன்லி ரோட் டிராஃபிக் ஆக்சிடென்ட், வி ஆல்சோ டீச் அதர் எமர்ஜென்சி கூட அந்த மாதிரி பண்றோம். அதே மாதிரி இதுவும் இல்லாம ஸ்கூலு காலேஜஸ்ல டெமோ பண்றோம். ஒரு இன் கேஸ் ஆஃப் எமர்ஜென்சி, மல்டிபிள் எமர்ஜென்சி, ஆர்டியா இருக்கலாம், கார்டியாக், ஸ்ட்ரோக், எது வரனாலும் ஒரு ஆம்புலன்ஸை கூப்பிடுங்க. ஆம்புலன்ஸ் வர வரைக்கும் என்ன பண்ணணும், என்ன பண்ணக்கூடாது. பட் இந்த அவேர்னஸ் இப்போ பப்ளிக் ரொம்ப நல்லாவே வந்துருக்குது. முன்னாடி இந்த க்ரௌடு வந்து இஎம்டி போனாங்கன்னா இறங்கினதுக்கு அப்புறம் அவங்களை அலோவ் பண்றதுல நம்ம எல்லாமே பப்ளிக் வழி விட்டுட்டு இவங்க வந்து ட்ரையாஜிங் பண்ணி பேஷண்ட்டை வந்து நல்லா கேர் எடுத்து அந்த ட்ரையாஜ் பண்ணி ஷிஃப்டிங்ன்றது ஆம்புலன்ஸ், தென் வந்து எங்களோட எமர்ஜென்சி பிசிஷியன்ட்ட கோஆர்டினேட் பண்ணிட்டு அவங்களுக்கான தேவையான மெடிசன் ஸ்டார்ட் பண்றது. இப்போ பப்ளிக்ட்ட நல்ல அவேர்னஸ் நல்லா வந்துருக்குது இப்போ. பட் என்ன இந்த உங்க மாதிரி அலர்ட் மாதிரி எல்லாரும் ஃபர்ஸ்ட் எய்ட் கொடுக்கும்போது இட் ரியலி இட் ஹெல்ப்ஸ் த பீப்புள். ஏன்னா டில் ஆம்புலன்ஸ் வரைக்கும் என்ன செய்யணும் தெரிய மாட்டேங்குது. நாங்க பண்றதோ நீங்க அலர்ட், நீங்களுக்கு ஃபர்ஸ்ட் எய்ட் எல்லாம் பண்ணிட்டு இருக்கீங்க. இப்போ இந்த கம்பேரிட்டிவ்லி 2-3 இயர்ஸ் பேக் பண்ணீங்கன்னா நோ யூ பெட்டர் த பீப்புள் ஹேவ் பெட்டர் ஐடியா. கார்டியாக்னா சிபிஆர் ஸ்டார்ட் பண்ணணும்னு சொல்றாங்க, சிபிஆர் ஸ்டார்ட் பண்றாங்க, அவங்க சொல்றாங்க சிபிஆர் கொடுத்துருக்காரு சார், ரொம்ப சந்தோஷமா இருக்கலாம் கேட்கும் போது. நாங்களும் இந்த மாதிரி ஸ்டார்ட் பண்ணிட்டு தான் இருக்கோம். இன்னொன்னு என்ன ஃபர்தரா அதே என்ன பண்ணிட்டு இருக்கோம்னா, இப்போ தமிழ்நாட்டுல பாத்தீங்கன்னா சார் தவப்பள்ளி சார் கூட ஒரு மெம்பரா இருந்திருக்காரு சார், நல்லாவே தெரியும். தாய் அப்படின்றது தமிழ்நாடு ஆக்சிடென்ட் எமர்ஜென்சி கேர் இனிஷியேட்டிவ். என்ன பண்றாங்கன்னா, ஒன்ஸ் இந்த இஎம்டி போய் அந்த பேஷண்ட்டை எடுத்து ட்ரையாஜ் பண்ண இமிடியட்லி ஆஃப்டர் ஷிஃப்டிங் டு தி ஆம்புலன்ஸ் வி டு தி ட்ரையாஜிங், வி டு தி வி ஸ்டார்ட் தி ப்ரீ ஹாஸ்பிட்டல் கேர், வி ஆல்சோ டேக் தி பிசிஷியன் அட்வைஸ். வாட் இஸ் தி EMT is a paramedical, though it is a paramedic, but it is not advised supposed to start anyone IV life without the advice of physicians. So definitely physician கேட்பாங்க, கேட்டுட்டு they will start the emergency. In case of red patient, what our EMT is doing it, he gives the pre-arrival intimation to the nearest hospital where he is taking the patient, all the vehicle of the patient and expected time of arrival. So அப்ப தாய்ஸ் என்ன பண்றாங்க, they are preparing. Okay, this is a patient, I'm expecting another 20 minutes, these are the weight of the patient. So immediately they receive the patient into the hospital. So if you see the road traffic accident in case of 2016 it was some 17,280, but now the last year is only 10,000, 7,000 death has been reduced. It is a phenomenon, it is really a tremendous effort. It's also other stakeholders are there. It's a tremendous effort taken by the health department, the Thai and as well as an ambulance. So we also, that is what we study, we have taken the study where all accidents happens, we identify the exact location, we have trained the people. Now we are going to start in other district also. And even there are so many people sitting trained by alert, other NGOs also training their public what they supposed to tell arrival of ambulance. In the awareness on there, now I think I can tell you within the last 3-4 years, more than 50% of the people are now they know what they're supposed to do, what they're not supposed to do. Really, the one thanks goes to the alert. Okay.
Oh, wonderful, wonderful. This is the promising hope that we are working towards. And இதுல வந்து இந்த சிஸ்டம் சைட்ல இருந்து இந்த என்ன எக்ஸாக்ட் நடக்குதுன்னு மக்களுக்கு அந்த விழிப்புணர்வு இன்னும் ஜாஸ்தி ஆகும் போது the challenges that you face in ensuring that delivery is more efficient, that will also அது ஒரு பசில் மாதிரி அது மைண்ட்ல போய் உட்காருங்கிறது தான் the whole initiative of this panel specifically is. So thank you for also explaining exactly what is the process that goes behind, because makkala பொறுத்த வரைக்கும் கால் பண்றாங்க 108 வராங்கிறது, but there is so much of a process that goes behind actually improving the
now as you know that we identify earlier the response time now when you call an 108, the caller is calling an 108 till the ambulance reaching to the spot. See, it's called response time.
Right.
If we identify once we got sense, we are identifying the where we are getting more number of calls, especially the road traffic accidents. Say for example, we have in Tamil Nadu, we have 7% is the national highway, where 70% of the death happens in national highway. So we identify the exact place. We are parking the ambulance close to the scene. When caller calls 108, we now if we have the app 108 Avasram app in Play Store, if you download it and if you call through the app, you need not explain where you are. So automatically pitches the district, taluk, everything, lat long, everything is automatically pitches. Right. There are some callers who doesn't have this smartphone or not having this app. They're calling some normal phone. They will ask the district, taluk, and the locality. When you put we have the main map India. When you pitch the particular location, it automatically pitches the lat long of the column location. And also the back end, it automatically searches the nearest 6 ambulance with the kilometers.
Right.
It automatically displays to the emergency response officer where the ambulance is. So we will call automatically closest ambulance. Then we will call this is an emergency so on the place. Then we will connect the caller and the ambulance. Both will be linked. Then they will talk. You will tell about the emergency, what type of emergency, so that our emergency technician has to prepare. And the prepare பண்ணனும் case சொல்லிட்டு. So இந்த மாதிரி பண்ணிட்டு immediate அந்த ambulance reach ஆனதுக்கு அப்புறம் reach ஆகும்போது our protocol is that every 5 minutes we have to call the caller. இது எதுக்குன்னா caller to have the confidence. Yes, I am coming on the way. Just wait. To just give the moral of the caller as well to the patient. When immediately after reaching to the scene, we will, as I said earlier, we will do the triaging system, first aid, and then when the patient is critical, then it comes under that category. After admission into the hospital, we used to follow the patient after 48 hours. If the patient is alive, the red patient, critical patient is alive even after 48 hours, then we used to call it as we are saving one life.
Okay.
So far, since inception, Tamil Nadu, so far we have crossed 7,20,000 lives saved. Okay, this is our calculation.
Okay.
So I request the viewers, what I am requesting is everyone should undergo the first aid. The main first aid what he is supposed to do, that's okay. What is not supposed to do, that also should know.
More important.
Especially in the road traffic accident. Right. So everyone, as a Honorable Health Minister, Health Secretary, we have to train the entire Tamil Nadu. 87.8 population trained one. Everybody should know what is first aid. Right. So that is a crucial. Till the ambulance reaches to we're taking 8 minutes, 10 minutes, or 15 minutes time. Till the ambulance reaches, what is supposed to do. So that's first aid. Kandipa ellarkum therinjirukundradha Tamil Nadu Health Minister சொல்றது அதே கிடையாது.
Absolutely, sir. Absolutely. I mean, that is the core purpose of existence of alert. Again, to the goal given to us by Dr. Kalam, one in every family to be trained. So, with all your support, we are marching steadily. I will go back to Dr. Dhavapalani. I have one specific question on. You've also been part of some of the international forums and what happens in some of the slightly advanced societies, both in terms of the awareness of the general public and also in terms of systems. So if we were to look at some best practices from somewhere, from any part of the world or from any other part of the world and all that, What are those 2-3 things that you think we should pick up? One, for the better efficiency of the system itself. We have definitely done a lot when compared to probably many other states, but still there's a lot of scope ahead as well. So from a community angle, what are the best practices? Specifically in a cardiac arrest, I mean, still, as far as CPR is concerned, less than 2% of the population in India is actually, really know CPR, right? So, so I would like to know your thoughts on what are some of the best practices around the world that you think that can be incorporated. Not everything can be a plug and play, but within the challenges we have in our country, both from a community angle and from a system angle, specifically that will benefit the doctors, who are end of the day, are at that end of the spectrum to ensure that the victim of an emergency recovers completely.
CPR training should be part of the school curriculum. So most Northern Europe and Western Europe, they inculcate these good practices in higher school forms, say beyond 8th standard and above. So they would make it mandatory, compulsory in their school curriculum. And there should be a reiteration at college level as well. So either they can get it done in their school premises, or they need to be encouraged to get a certificate from an NGO like Alert. So I think lots of them. It's really terrible. And India is the heart disease capital of the world.
Right.
Most of the heart diseases, even if they have the best person to resuscitate, so to put it in simple terms, if I were to receive somebody in cardiac arrest, I would rather prefer to have somebody with a heart attack and a cardiac arrest, because my chances of reviving him are the highest.
Right.
If somebody with extreme blood loss or very severe infection, sepsis, my chance of reviving those two are less. So whereas India is the heart disease capital, and the chances of us reviving these guys if they receive bystander CPR and initial CPR will be normally high. So school level, college level needs to be made part of the curriculum. And people should be encouraged, and people should be made to feel empowered and happy that they've provided CPR. Yeah, I mean, I've attended some of your previous programs where you congratulate and you really bring them on to stage and give them some accolades. So those kind of practices should be there. High yield interventions, first aid what really yields, what could be life saving with a minimum of effort is something that we need to identify rather than cumbersome futile efforts. So high yield simple efforts. And the back slap
Right.
every mom delivery mudinju porappaye, so they need to be taught, or when they come for the first or second follow up,
Right.
and the mothers we need to teach them what is choking, what needs to be done. Yeah, that's the ideal phase. Or when they start weaning them when the child is still very young. So those are the phase. Or 8 where they want to taste everything, put everything into their mouth. So those are the periods when all these happen.
Right.
And safety about electrocution, how to so moms need to be taught in the community, specifically speaking. Mom and younger children need to be taught how to deal with these emergencies.
Okay.
I think these courses should be made mandatory. So movie theaters இது போடுவாங்க இல்லையா, நியூஸ் ரீல் போடுற மாதிரி. So that's one way of thinking about all of these simple cartoons, simple ways to get the message across.
Wonderful. Yeah. So there's some best practices there, and of course I cannot be not in total agreement with you that we have to make this mandatory into the education system. 5th grade, US it is part of the syllabus of the 5th grade. And of course, I think the homemakers most important, and when you teach them, probably you're teaching a couple of generations together, right? So I really take this opportunity to also thank you for many a times you being personally there to assess some of our volunteers in case of emergency. After a rigorous training, they get presented to you, and to go through it adds a lot of seriousness to the program, and also it instills, and as I said, there is also a pride element required from a general public perspective to know that it is coming from authentic sources, and also that they can go forward and help. So I'll back to Mr. Selvakumar. One question again from a general public perspective. I also, once in a while when I visited your campus, I see the buzzing call center and people taking these calls, and day in and day out, all through the day it is buzzing. Is there anything that as a improvement from a public's viewpoint, and the call உங்களுக்கு சென்டர்ல வரும்போது the quality of the call, when I say caller கிட்டேந்து வரும்போது அந்த if the call can be a more intelligent call, right, how much of an impact that can have on reducing the time even further? நீங்க questions நீங்க கேக்குறீங்க இல்லையா, ஒரு set of questions that you're asking. இது முன்கூட்டியே வந்துட்டு ஒரு public viewpointல இருந்து கால் வரும்போதே if it's an intelligent call, so இந்த நாலஞ்சு விஷயம் நீங்க கால் பண்ணும்போது கேதர் பண்ணிட்டு கால் பண்றதுனால and even those few seconds can be even further reduced.
So, it's a very good question. Actually, see what we have, the present setup of our emergency response center is, when caller calls, or set up question, yes, we have some set of questions. That first, what is an emergency? What type of an emergency? That's the first question. Then what is a road traffic accident, cardiac, fever, whatever. This is the first question they ask. Second, in the district. Next, in the talu. Third question, which is the locality. These are the set of questions. But normally, what we find is, but there are call or a week, it is easy for them to answer these questions. But say if you're traveling on highway, since I told you the highway the maximum accident, now highway travel maybe may not be from Tamil Nadu, other state also, you may have to know which district, which is taluk. What we are doing is Avasram 108 app. We are requesting everybody to download that app. Call you need not to say anything, including your name, where you are calling. Everything will be displayed automatically. That's one. That is present system. Other and the update பண்ணி வச்சிருக்கோம். யாரெல்லாம் நீங்க அவசரம் 108 ஆப் டவுன்லோட் பண்ணி கூப்பிட்டீங்களோ, இட் இஸ் வெரி ஈஸி ஃபார் அஸ். நெக்ஸ்ட் கொஸ்டின் கேட்க மாட்டாங்க, நீ எங்க இருந்து கூப்பிடுறீங்க, டிஸ்ட்ரிக்ட் ஆளுக்கு எதுவும் கேட்க மாட்டாங்க. ஆட்டோமேட்டிக்கலி இட் பிச்சஸ் யுவர் காலர் லொகேஷன்ஸ். So nearest ambulance also automatically pitches. So simply they will ask what is an emergency. Okay, so on ambulance coming. This is one point. And second thing, இப்போ that அடுத்து further என்ன டெவலப் பண்ணிட்டு இருக்கேன்னா, even the people may not be having the smartphone, may not be having the GPS. So அதுல ப்ராப்ளம் வரதுனால now the based on the tower locations, where that the technology is going to try to do that. So wherever you call, based on 3-4 tower locations, it will automatically pitches your lateral. It may be the accuracy 10% variation is there. That is a second development. What do we have? And presently, when you know advantage, when you call the ambulance through an app, it is yet to be implemented and waiting for some technical server upgradations going on now. When you call through an app, as I said earlier, need not to tell any district, everything in pitches. When I am assigning the nearest ambulance, that automatically notification is also coming to the caller.
Right. Okay.
This is the ambulance. This is the mobile number of this ambulance. It's coming from so and so place to so and so. It's coming reaching you. When you click the notification in the smartphone, you can able to see our ambulance the way you are looking at the Ola and Uber. So இதுல என்னன்னா, எல்லாருமே அந்த அவசரம் 108 எவ்வளவு ஒரு நம்ம எத்தனையோ ஆப் எல்லாம் வச்சிருக்கோம் இல்லையா, அவசரம் 108 ஆப் டவுன்லோட் பண்ணி வச்சிருந்தீங்கன்னா that really helps in emergency for easy assignment. So it reduces a lot of time for assignment, and also the ambulance is as early as possible.
Right.
And you can also view the ambulance where it is coming. And one more upgrade பண்ணிட்டு இருக்கோம். You can also see after picking you where you will go, which is a hospital, where you will go. That also you can see.
Okay.
Everything is automation now. This is yet to be implemented very shortly. Now the technical upgradation is under progress. And as a caller point of view, அங்கிருந்து பாத்தீங்கன்னா என்னன்னா, எங்களுடைய ஒரு காலர் கால் பண்ணும்போது ஒரு ஆக்சிடென்ட், ஒரு கார்டியாக்னா, சார் ஆக்சிடென்ட் சார், வண்டி அனுப்புங்க சார், எங்க சார், அடையார் ஆனந்த பொண்ணுக்கு முன்னால சார்,
Okay.
We don't know which is Adair out on the board. So of course it is an emergency, அவங்க பேனிக்ல இருக்காங்க. So அவங்கள வந்து we have to bring down.
Right.
நம்ம ஒரு பண்ணி அவங்கள கொண்டு வந்துட்டு, but what we assign is the within 120 seconds maximum what we are taking right now time.
Okay.
Within 120 seconds will go off.
Okay.
We will cut the collar, we will assign an ambulance. But we are planning exactly 50 to 60 seconds with all these technological developments.
Okay. Okay. Fantastic. 50 to 60 seconds can be achieved. I think we can move to the next level. It's about close to 50% of reduction in the total response time. It will make a big difference to the entire ecosystem of emergency response.
Just I wanted to request on one thing. So as I said earlier, what happened is, say we are training the first responder. As I said, we are the nearest accident place, we are the place. We are training the nearest shop owners or the school and colleges. So I want just to highlight one incident. That there was an accident near Padalam, you might be in the highway after the Sengalpattu.
Okay.
There was an amputation. Okay. And one college student who passed that way, he just stopped. He only called the injury.
Okay.
And he did a tremendous first aid there.
Okay.
Blood loss. Okay. When we asked him, sir, you have only trained in this way. I attended to the training class, first response training class. So what he was telling is, I don't have any fear.
Right.
எந்த பயமே இல்ல சார், நீங்க சொன்னதை வச்சு பண்ண முடியும்னு சொல்லும் போது, இதே மாதிரி சப்போஸ் நீங்க அலர்ட்ல இருந்து பண்றீங்கன்னா, இப்ப எங்க ஆம்புலன்ஸ் ரீச் ஆகும் போது அவங்களுக்கு தெரியுது, எங்களுடைய மெடிக்கல் டெக்னீஷியன் தெரியுது, ஓகே somebody is trained first responder கொடுத்துருக்காங்கன்னு. அந்த மாதிரி உங்களுடைய எந்த whichever NGO மேபி அலர்ட்னா கூட அந்த மாதிரி சொன்னாங்க, சார் ஐ அம் ட்ரெயின்டு பை அலர்ட்னஸ், it will be easy for us to highlight, to motivate the people further. இந்த மாதிரி எல்லாம் கத்துக்கணும், நீங்க பண்ணுனீங்கன்னா till ஆம்புலன்ஸ் வரைக்கும் செய்யலாம் அப்படின்ற மாதிரி. ஸோ இப்போ அலர்ட் ட்ரெயின்டு சார், நான் அலர்ட் ட்ரெயின்டு சார், நான் வந்து ஃபர்ஸ்ட் எய்ட் பண்ண முடியும் சார் இல்லை, அந்த மாதிரி அந்த காலர் வந்து சொல்லும் போது we are conducting the good Samaritans.
Correct.
We are also conducting the good Samaritan. Every district chaired by the district collectors.
Right.
We are avoiding the callers. Okay, there it will be easy for us to highlight, சார் அவங்க வந்து ட்ரெயின் பண்ணிருக்காங்க சார், NGO ட்ரெயின் பண்ணிருக்காங்க. ஸோ எல்லாம் அந்த மாதிரி சொல்றதுக்கு இப்போ காலர் உங்களுடைய அலர்ட் ட்ரெயின்டு ஒரு இருந்திருந்தாருன்னா சார் ட்ரெயின் சொன்னாங்கன்னா it will be great for us. And எல்லா டிஸ்ட்ரிக்ட்லயும் we are conducting the good Samaritans. We are highlighting this. We are appreciating the callers. Okay, உங்களால தான் ஒரு லைஃப் சேவ் ஆயிருக்குது. But we take the good Samaritan. There should not be any blood relations. அந்த மாதிரி தான் எடுக்கிறோம் good Samaritans கலெக்டர் அவார்ட் பண்றதுக்கு. யாரோ ஒரு பாசர் பையா இருக்கணும், கூப்பிட்டுருக்கணும். Because of that we have saved somebody's life. So அந்த மாதிரி good Samaritan கண்டக்ட் பண்றதுக்கு to encourage the people, it will be really easy. ட்ரெயின் பண்ணா ட்ரெயின் சார், so and so NGO ட்ரெயின் பண்ணிருக்காங்க சார் அப்படி சொன்னாங்கன்னா we can highlight this. That
wonderful. Wonderful. Definite. I mean, I'm sure we will weave it. We have already weaved it into our protocol from a volunteer point of view, that when you make a call, introduce yourself, because it will be a useful information at the other end, that அவங்க வந்து
குற்றமே சொல்லலாம் நாங்க.
Correct. Yeah. So certainly, and I'm very glad that you have இத பத்தியும் நீங்க இப்ப எடுத்து சொன்னது நிறைய பேருக்கு போய் சேரும் இது. So thanks for bringing this aspect as well out. So any other, I mean, as an NGO, alert engloda focus is to build this capacity, and you see we can seamlessly sort of work together hand in hand to end of the day save many more lives. Ipo in the voice abdingar and the concept that we have started the volunteer in case of emergency. In fact, we would love to explore opportunities where we could integrate, or we could seamlessly we use the technology to interact, because now technology is making all of it possible. So we will certainly be exploring those opportunities with the other extended systems that are there, which are government machinery. Certainly we'll be wanting to support all of that. So today, being the World First Aid Day, anything else and that you would want to say in a minute or two you can take. And also to alert, as an NGO, we are in the 14th year of service, reached out to about 140,000 people so far, but we know we have a very long way to go to achieve this dream of at least one in every family to be trained in emergency response. So I'll start off Dr. Dhavapalani, a message to everybody, and anything that you want alert to be focusing, doing more, so that we could add and contribute more to this cause of saving lives.
I think to the public, the key message that Mr. Selvakumar said, that people shouldn't be afraid to volunteer. So the fear of kind of wanting to volunteer should go. They should really be unfazed by the emergency, and they should have a clear mind, and that comes with training and the mindset. So I think that will be the message for the public. To alert, I think you are doing a grand job, but I guess you need to scale it up, and I guess there will be constraints, and everybody, it should reach far wider. And I'm sure you're already working on it. So that will be my message.
Sure. Thank you. Thank you. Thank you so much, Dr. Dava, for that words from you as a message. Mr. Selvakumar?
That's what as I told you earlier, you have to support the person who's actually trained first aid, the first responder or first aid trained now. They are very confident to do. Okay, ambulance கூப்பிட்டு ambulance என்ன பண்ணனும்னு சொல்றாங்க இல்லையா? It will be more focused towards the road traffic accident.
Right.
Because we are losing almost more than 10,000 people as of now in a year.
Correct.
You have to train the people what is supposed to do in case of emergency. Apart from the other emergency like choking, other emergency பண்ணும்போது இதை வந்து more focused highlighting, அதாவது rather than conducting everybody at a time, எந்த ஏரியால is required first, where the number of emergencies comes more, there let me train that first responders. Of course the first responder முன்னாடி சொன்ன மாதிரி honorable health minister சொல்லிருக்காங்க எல்லாரையுமே ட்ரெயின் பண்ணனும், பட் எல்லாரையும் ட்ரெயின் பண்றது immediately it is not possible, but it is need to focused which area where. So for example, I can tell you, if you go to the Trivedi Oothukottai, and the area கொஞ்சம் poison and snake bite cases are more.
Right.
So அந்த மாதிரி ஏரியா ஐடென்டிஃபை பண்ணி அந்த பர்టిక్యులர் ஏரியாக்கு நம்ம அந்த மாதிரி ஃபர்ஸ்ட் இன்னும் ஃபோக்கஸ்டா பண்ணும்போது I'm sure you can save more lives. இப்போ எங்க ஸ்னேக் பைட்னா திஸ் பர்టిక్యులர் ஏரியா பர்టిక్యులர் செக்மெண்ட் தான் ஸ்னேக் பைட் அதிகமா இருக்கு, சூசைட் பர்టిక్యులர் செக்மெண்ட் தான் அதிகமா இருக்குது. ஸோ அந்த பர்టిక్యులர் ஏரியா ஃபோக்கஸ் பண்ணி கொடுத்தோம்னா, so the immediately will get the result. That is a low hanging fruits. Immediately will get some result. So that is my view. If you focus that.
Sure. Thank you so much for sharing your thoughts, both Dr. Dhavapalani and Mr. Selvakumar. I know it is actually a busy time, middle of the day, and a busy time, and specifically in the time normal away. I mean, you are busy people, but these times I think through the living through the COVID times and all that, it's the much more to handle. And you've been phenomenal COVID warriors, frontline warriors. We all look up to you for this phenomenal work that you do, and we want to support your endeavors in as much as we can to also ensure that we don't lose lives because of lack of available help, or available of help little late than what ideally it should be. So I want to thank you for joining us today, Mr. Selvakumar and Dr. Dhavapalani. Romba nandri for joining us on this panel.
Thank you so much for inviting us to share our views. Okay.
Thank you.
Thank you so much.
Thank you.
All these hospitals are there only if these patients can reach. What you are doing is a very noble service. You are able to first, for a person who would otherwise have lost his wife, you kept him alive. So I think the front mark goes to you. So you get the 99, that one person goes to the hospital.